The idea behind the measure is to provide timely, appropriate support in a local setting. The aim is to address low-level problems before they escalate and to offer support to patients with more severe illnesses who are currently managing reasonably well. The focus of this will be a primary care mental health worker, someone trained in mental health issues, able to work with the GP to assess patients' needs and to connect the patients with a wide variety of different kinds of support. We talk to a range of people who've experienced mental health problems.
My condition is anxiety. I have it's like a long-term depression, treated by tablets, but I've got the treatment I have is more self-help.
So did Jeff think it was a good idea to have a mental health specialist in his GP surgery?
Oh yeah, definitely, because GPs, they haven't got the time to spend with you, and people who are suffering with some sort of mild or severe mental health problems needs that time to sit down and just express how they're feeling and just have general feedback and reassure them how their health can improve.
I have bipolar, and I am learning how to treat it. It's sort of, you know what you can do and what you can't.
Mo's a key member of a peer support group. So what would help her?
Help and support. I mean, the point is that support with mental health is absolutely brilliant, because if you've got no one, you know, it's really, really hard. And it's like my experience at one time, I didn't have anyone. So I found then that to sort of, it was good to have somebody when you've never had it. And yeah, I think it will work.
The measure applies to all ages. Alex is recovering from a problem that's brought him into contact with both primary and secondary care services.
Well, it was because my weight was very low and I was having issues around eating. But at the moment, I'm doing a lot better. So, yeah, things are good at the moment.
So what does he think of the ideas behind the measure?
No, I think it's a brilliant idea. If they have, you know, a sort of specialist mental health person, that would be, you'll catch the illnesses quicker and it'll help the people better. And yeah, I think it'd be a lot better.
86-year-old Jim is generally fit and well, but he suffers from dementia.
Well, Jim was diagnosed with Alzheimer's 11 years ago. He's actually done extremely well, but he's got no short-term memory at all. And if we have to go to the doctors, I go in with him, because he would probably not remember to say why he's even there.
Would having a mental health specialist at the GP surgery help them?
I think it would make a big, big difference, because you would know your first point of call. It would really help, because they would know the situation, and I think it would be a wonderful idea.
My dad has vascular dementia, was diagnosed about a couple of years ago.
Is Sarah happy with the support her father's GP has been able to provide?
No, because, you know, tablets obviously can do so much, and it's important that he takes them, obviously. But I think that, you know, the other support is just as vital to make sure that, he eats properly, and that he has a social side, that there's groups that he can get involved in.
I got OCD, obsessive compulsive disorder.
OCD affects many aspects of Neil's life. Does he like the idea of a practice-based mental health worker?
To be honest, I think so, to be honest. From what I hope I am being practicing on, but I said, from what I'm trying to say is, although they're not experts in it, and although you do give them the problems, they do seem to not. It's a very difficult condition to grasp. So if somebody was there who had some sort of idea that I could come to regular, and if I have been discharged by a psychiatrist, so hopefully there's someone nearer I can go to on a regular basis, it would be much appreciated, to be honest. And hopefully then my problems could be sorted out quicker, or a greater understanding of what my condition is.
There will be only one primary care mental health worker for every 20,000 people, and they'll be human, so not all of these expectations will be met. But the mental health measure puts a legal obligation on local authorities and health boards to provide assessment, referrals and appropriate treatment in primary care for people with low-level mental illness, as well as the information and advice to allow those patients to look after themselves. As the measure beds in, people will begin to experience a very different kind of mental health support in primary care.